Coronaviruses are a family of viruses, known for containing strains, that cause potentially deadly diseases in mammals and birds. In humans they're typically spread via airborne droplets, of fluid produced by infected individuals. Some rare but notable strains, including SARS-CoV-2, responsible for COVID-19, and those responsible for severe acute respiratory syndrome (SARS) and Middle East respiratory syndrome (MERS), can cause death in humans. If you cannot subscribe our channel, make sure to subscribe us. First described in detail in the 1960s, the coronavirus gets its name from a distinctive corona, or crown, of sugary proteins that projects from the envelope surrounding the particle. Encoding the virus's makeup is the longest genome of any RNA-based virus, a single strand of nucleic acid roughly 26,000 to 32,000 bases long. There are 4 known genuses in the family. Named alpha coronavirus, beta coronavirus, gamma coronavirus, and delta coronavirus. The first 2 only infect mammals, including bats, pigs, cats, and humans. Gamma coronavirus mostly infects birds, such as poultry, while delta coronavirus can infect both birds and mammals. Symptoms of a coronavirus? Coronaviruses can give rise to a variety of symptoms, in different animals. While some strains cause diarrhea, in pigs and in turkeys, most of the time infections can be compared to a bad cold, causing mild to moderate upper respiratory problems such as a runny nose and sore throat. There are a handful of lethal exceptions, which have had a devastating impact on livestock and human health around the globe. COVID-19, SARS-CoV-2. SARS-CoV-2 was first identified in the Chinese city of Wuhan in 2019. At the time of writing, numbers of infected are still on the rise, with a mortality rate of around 1%. Snakes were originally suspected as a potential source for the outbreak, though other experts have deemed this unlikely and proposed bats instead. As of February 2020, the search for the animal origin of COVID-19 is ongoing. Severe acute respiratory syndrome (SARS-CoV). SARS was first recognized as a distinct strain of coronavirus in 2003. The source of the virus has never been clear, though the first human infections can be traced back to the Chinese province of Guangdong in 2002. The virus then became a pandemic, causing more than 8,000 infections, of an influenza-like disease in 26 countries with close to 800 deaths. Middle East respiratory syndrome (MERS-CoV). MERS was first identified in Saudi Arabia in 2012, in people displaying symptoms of fever, cough, shortness of breath and occasionally gastrointestinal problems, such as diarrhea. An animal source for the virus has never been officially confirmed, though evidence points to dromedary camels as a potential reservoir of infection. The World Health Organization has identified around 2,500 cases of infection in 27 countries since initial outbreaks, resulting in nearly 860 deaths. Symptoms of coronavirus. Coronavirus disease (COVID-19) is characterized by mild symptoms including a runny nose, sore throat, cough, and fever. Illness can be more severe for some people and can lead to pneumonia or breathing difficulties. More rarely, the disease can be fatal. Older people, and people with other medical conditions, such as asthma, diabetes, or heart disease, may be more vulnerable to becoming severely ill. People may experience runny nose, sore throat, cough, fever, difficulty breathing, severe cases. Prevention from coronavirus. Clean your hands often. 1. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place, or after blowing your nose, coughing, or sneezing. 2. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. 3. Avoid touching your eyes, nose, and mouth with unwashed hands. 4. Avoid close contact. Avoid close contact with people who are sick. 2. Put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at higher risk of getting very sick. Total number of patients of coronavirus in world are 156,885, whereas nearly 70,000 people have recovered from coronavirus and total number of deaths around the world are 5,839. Thanks for watching our video. Make sure to subscribe us and press bell icon for latest updates.